cutting through the red tape to care for wounded warriors. Just moments ago, President Obama outlined plans for improving veterans' health care using lifetime electronic medical records. So we want to get reaction from a veteran who was at the president's news conference. Paul Rieckhoff is founder and executive director of Iraq and Afghanistan Veterans of America, and he joins us now from outside the White House. And Paul, if you would, give us your general reaction to the president's comments.
Well, we welcome this news, Tony. This is a huge day for veterans and troops. The president outlined two major initiatives that veterans groups and military groups have been calling for years. First off, he's going to provide one seamless electronic medical record-keeping system that takes the troop or veteran from the Department of Defense over to the VA for their entire life. And he's going to support advanced funding for the VA, which will provide timely, predictable funding at the VA. It'll set up the new Secretary, Eric Shinseki, for success. And it's really going to help us deal with a multitude of issues ranging from post-traumatic stress disorder to traumatic brain injury. It's a good day. All the veterans groups are there to support the president, and this is a good way for him to come back from Iraq and make a powerful statement.
I got to ask you something. There is still an open question, isn't there, on trying to get more money into the VA system, aside from the budget lines appropriated for this, but there is still, isn't there, an open question of getting more money from other sources into the system to care for veterans?
Well, it's a question of money, and it's also a question of oversight and accountability. The budget the president's proposed is one that's exceeded the independent budget, a budget that all the leading veterans groups asked for. It's a record increase, the highest number in about 3 decades, so that's a good start. But General Shinseki, Secretary Shinseki now, is going to have to provide the oversight in making sure that that money gets down to every local VA hospital. VA's got over 170 hospitals around the country. It's the second largest bureaucracy in the U.S. government, but a lot of vets are still falling through the cracks. So he's going to have to ensure that money's getting down to the lowest level to communities around the country.
Boy, and you, I guess, would have to be applauded for your efforts here. There was a proposal not that long ago where insurers were going to be asked to buy into that system. Your organization and others like yours fought back on that. I'm wondering if you are privy to any of the ongoing discussions on how to get more money into the system.
Yeah, we've been involved in discussions within the House, the Senate, and with the White House to help them get this budget right. We did push back strongly against this proposed plan to outsource disability compensation to private insurers. All the veterans groups pushed back. The president listened. They dropped it. And now we're moving on to what I think are much bigger issues. And this budget's a good start. We're going to keep them honest. We're going to stay on them. But for most of the veterans around the country of all generations, not just Iraq and Afghanistan, this is welcome news.
Paul, good to talk to you. Thanks for your time. Thanks for coming out of the room so quickly for us. Paul Rieckhoff.